varicose vein. Okay. So we have three systems. One is arterial, another one is venous, and third one is lymphatics. So today we are going to talk about venous system. Okay. And one of the important disease of venous system is varicose vein. Okay. So what are the three criteria you have to say this is varicose vein? So it has to fulfill three criteria. What are the three criteria? It should be dilated, it should be elongated, and the elongated part is torsosity only, okay, and loss of compliance. What Bailey says, I will tell that only, okay. So before understanding the varicose vein, we'll bit understand about the venous anatomy. So I hope this is visible, okay. So this is what? External iliac vein, okay. External iliac vein, further continuation is a femoral vein, okay, femoral vein. So this part we can take as a common femoral vein, okay, common femoral vein. So we have two parts, one is deep system, another one has superficial system. When you will say it is superficial and when it is say deep. So one very prominent demarcation. So what is this structure? This structure is deep fascia. So venous system below the deep fascia is known as deep vein, and superficial to this structure is known as superficial vein. Clear? They ask below deep fascia, not superficial fascia. Which fascia? Deep fascia, okay. So in superficial venous system we have two important venous part, okay. So this one is looks big, so this is great saphenous vein, and this one looks small, so this is small saphenous vein, okay. This part is clear, and this deep and superficial system connected through some perforators, okay, and they have given name also, okay, and you have to remember this name. They ask the name of the perforator. Can anyone tell the name? Any name? Which one is Hunterian? The top one, huh? Okay. When this perforators coming through the adductor canal, okay, so this part is known as Hunterian perforator, okay, okay. This one dot, okay. So here it is a knee, okay. So above the knee is dot. You can remember like daddy is on the top, okay, and the below the knee is void, B for below, okay. So Hunterian dot void. What about this one? Clocket, okay. So lower limb perforators known as clocket, and this one is May and Kushner, okay. So ankle perforator is known as May and Kushner, okay, okay. And there is one connection between the short saphenous vein and great saphenous vein. Can anyone tell this name of this small vein? Very famous question. They have asked multiple times. Giacomini vein. Very good. Okay. Giacomini. So this is the cranial extension of short saphenous vein. Remember, they ask this is the cranial extension of which vein? Short saphenous vein. Okay. Okay. So they drain the blood via the deep venous system, superficial venous system, okay. Okay. So any competency in the either deep venous or superficial vein will lead to which disease? Varicose vein, okay, varicose vein. Okay. So mainly varicose vein affects superficial vein or deep vein? Superficial vein, okay, superficial vein. Okay. So pathology can be in the perforator, okay, can be superficial vein and can be in the deep vein. So deep venous pathology known as DVT, deep venous thrombosis. Okay, this perforator is known as perforator incompetence, and this is superficial venous system. Okay, mainly affect varicose vein, affect mainly superficial venous system. Okay, so we have understood the pathophysiology. Okay, so now tell me the sign and symptom, clinical feature of varicose vein. Pain, where? Headache, then pain in lower limb, okay, pain in lower limb, okay, and then varicose vein, okay, then okay, we'll go into pathophysiology a bit more, okay. So I said for varicose vein there should be dilatation. So how much dilatation, okay? So less than 1 mm known as telangiectasia, also known as other name what? Hyphen vein and thread vein, okay, thread vein is, and so this is telangiectasia, okay. This one is reticular vein and this is varicose vein, they ask. So this is telangiectasia, this is reticular vein, this is varicose vein, okay, fine. So patient will present as a pain, okay, pain while walking, okay, in lower limb. And other symptoms like risk factor for varicose vein, occupation is related to varicose vein, which all occupation? Which required long standing, okay, which all occupation required long standing? Surgeon, then teachers, then traffic police, then what? Army. Yes, there is a family predisposition factor, okay, okay. Other factor more common in male or female? Why? ज़्यादा काम because of pregnancy. How pregnancy causes varicose vein? Uterine compression will lead to increased venous hypertension. So what is the main pathophysiology about the varicose vein? Because of increased ambulatory venous hypertension. This is the main pathophysiology, okay. So increased venous hypertension, okay. So you have got one patient which is teacher by occupation, female, okay. Other risk factor, she has 3-4 other family member also having varicose vein. Other, and she is smoker or non-smoker? Smoker, okay, smoker. How smoking affect varicose vein? Decreased collagen production, okay, decreased collagen, actually maturation, okay, okay. Any other risk factor? Short or tall, okay, tall, okay. Obesity, yes, obesity you can say. Then any abdominal tumor can cause varicose vein, okay. Others, any pelvic tumor can cause varicose vein, okay. Any other syndrome? May-Thurner syndrome can cause varicose vein. Anyone can explain May-Thurner? Which side? I will explain last, okay? This will be last question, okay? So, how you are going to proceed with varicose vein? Any investigation you will do? Direct duplex, or you will do some clinical examination? So, which all clinical examination you will do? You people all know which all test can be done? Okay, I will explain. I told we have 3 places we can have problem in varicose vein. So one is DVT, deep venous system, other one is perforator, and one is superficial system. Okay. So clinical examination also based on the where the pathology is located. So for superficial venous system, which all examination you can do? Yes, very good. Trendelenburg test 1. Okay. So how we will do this test? So patient should be on standing position or supine position? Supine position. Supine. In supine, what you will do? You will just milking. How you will do milking? Just raise that affected leg. Okay. And if you want, you can further massage that leg. Okay. Okay. Fine. Then you occlude the SFJ, saphenofemoral junction. How? Through, you can occlude through thumb also, and you can use tourniquet also. Okay. Okay. Then stand. Okay. Then what is your inference? What is your observation? Then no. Okay. I'll explain. So you have applied that tourniquet. Okay. So in tourniquet there are two possibilities. Okay. You have applied that tourniquet and there are two possibilities. This venous filling can occur from the top to below, and other possibility from the below the top. So if the venous is filling start from the top to below, means what is incompetent? SFJ incompetent. Okay. If starting from the below means SFJ is competent, but perforators are incompetent. Any confusion? They ask this question. Can I go ahead? Okay. So one for superficial venous system, and 2 is for perforator. Okay. 2 is for perforator. Okay. Other test. So other test you can do for perforator also. So which all test you will do for perforator? One is Fagan test. Fagan test. So Fagan test is for, remember, F for F. Fagan for facial defect. You have to see the facial defect. Okay. So F for F. Remember? Okay. Next we have Pratt test. We have next Pratt test. Okay. So Pratt test, double T. Okay. So you have to take that 2 crepe bandage. Okay. You will take 2 crepe bandage. They ask how many crepe bandage? 2 crepe bandage, and you have to roll down. Okay. The same thing you have in Trendelenburg test you have done same, but you have to apply the crepe bandage. Okay. When you ask the person to stand, and you slowly remove the crepe bandage, and you see which side the perforator is defect. Okay. That side will bulge out. Okay. And other test, Fagan test, we have talked about Fagan test, Pratt test. Okay. There is one Schwarz test also. Schwarz test. Have you heard Schwarz test? No. So if there are multiple valves here. Okay. So if this valve is defective, so in varicose vein patient, so there is a column of the blood. Okay. So you will put your thumb here and you will tap here, you will feel the air column movement. So this test is known as Schwarz test. Okay. Schwarz test. And regarding the deep venous system, the all clinical test mainly in deep venous system is absolute. Why? Because in DVT patient, if you do more vigorous maneuver, that clot can dislodge, that thrombus can dislodge and can cause pulmonary embolism. So mainly absolute. At least you should know the name. Tell me the name for DVT. What all test you can do? Homan test. What is Homan test? How it is done, Homan test? So you ask the patient to lie down. Mostly this patient is lie down, patient with DVT, okay? And you will do forceful dorsiflexion of the foot, and patient will have pain. In one book written there is no pain, and one book written is pain. But for your book, Belly and Love says patient will feel pain. So you know the patient will have pain. Okay. Okay. And there another test is Moose test. So remember M for muscle. Okay. So you side by side you compress the calf muscle. Okay. Compress the calf muscle and patient will have pain. So M for M. Okay. Okay. So we have done the clinical test. Okay. So now we will do the some investigation. Which all investigation we can do? Huh? Investigation of choice is duplex system. What is duplex system? Color Doppler, not just Doppler, color Doppler. So what is the importance of color? What is the color code in duplex system? Which two color are main two colors? Blue and red. So what is blue and what is red? Away from the heart is? Away from the heart is blue, red. Okay. So I'm want to bit clearance on this. Okay. Okay. So this is arterial system and this is venous system. Okay. So in which blood is flowing, suppose like this, okay, and you are placing the probe here. Now you tell, suppose here it is blue and here also blue. So, and here red and red. Tell me, blue means? So, simply if the blood is going away from the probe, okay, away from the probe, so it is blue, okay. So this is blue. This is coming towards the probe, na? So this will be red, okay, and this is blue. In this case, blood is coming from this side, okay. So this will be red and this will be blue. And what you are saying the towards the heart, it is true for arterial system, not for venous system. You read belly, okay. So you will do the duplex. This is investigation of choice. Any other investigation? You can do venography, but this is absolute, okay, and costly also. Don't do this venography, okay. So we have done the clinical examination, investigation. So now treatment part. So what are the treatment available? Oh, before that we have one famous classification, CEAP classification, okay. So this is very famous classification. If external has to ask one question from whole varicose vein, so this is the part, okay. From CEAP classification, they will ask the question. So what is C? C for clinical, E for etiology, A for and P for pathology. So mainly they ask question from the C, okay, C. So in C we have C6, okay. So what is C0? There is no varicose vein, okay, normal. What is C1? So I told you na, till up to 3 mm there is no varicose vein. Varicose vein start from more than 3 mm. So pathology start from more than 1 mm, then 1 to 2, 2 to 3, then more than 3. So in 1 there will be telangiectasia or reticular vein, okay. In C2, so remember 2V. In C2, we have 2V. So varicose vein comes under C2. Remember 2V, varicose vein. Okay. In C3, what is C3? Remember 3 looks like E. So it is edema. C3 is edema. Now C4. What is C4? C4 is 4 letter. Skin changes comes under C4. C4 skin changes. Okay. Now we have two things. Ulcer. So one we have healed ulcer, one is active ulcer. Which one will be healed ulcer? C5. This is more serious, no? We are coming from C1 to C6. So the symptoms are aggravating. So C5 will be healed ulcer, C6 will be active ulcer. Any confusion? I will ask. I will ask. So in 4 there are C4A, C4B, C4C. Okay. So I don't think they will ask that too much. At least you, for now you should know this classification at least. Okay. Okay. So we have done the classification also. Okay. So final you have to tell your diagnosis. So what is your diagnosis? Full diagnosis. Tell me full diagnosis. Sir, this is the case of primary or secondary? Primary, okay, primary, okay. When there is no obvious cause, then it is primary cause. Primary, then primary varicose vein of which system? Superficial system affecting which part? We have two superficial venous system. One is short venous vein, another one is long venous or great venous vein. So great venous vein on which side? Medial side, and short venous vein on lateral side. Okay. So it is involving the, according to you have to tell, it is involving the great venous system. Then is there any perforator incompetence? You have to mention in your diagnosis. Okay. If you can tell the name, it is very good. Okay. At least you should say, sir, there is a perforator incompetency. Then with complication and without complication. Complication means DVT. Okay. So complication means DVT. So this is your complete diagnosis. Can anyone summarize for me? Full sentence. Summarize. No, right? Take. So now treatment. Treatment part. First, patient come in OPD, you will take directly to OT and you will do ligation and all. First, they will ask, is there any medical treatment or non-surgical treatment? So, what are the non-surgical treatment? Stocking. Stocking and some, you will tell what? He has to stand prolonged or he should avoid prolonged standing. Then, okay? Viscard regimen for what? No, it is not varicose vein. Viscard regimen for venous ulcer. Okay? Venous ulcer, not for varicose vein. Okay. Okay. So you have to tell the patient avoid prolonged standing. Okay. Okay. Leg raising. She can or he can put the 2 pillows in the below the feet. Okay. And stocking. The main thing is stocking. So stocking, how it will help to prevent varicose vein? So this part of the vein is incompetent, okay, and this is deep venous system. So this part is not working fully, okay. So we are going to apply some pressure, okay. So while applying the pressure, this blood will push through perforator in which system? Deep venous system. So it will prevent the further aggravation of varicose vein. Understood? We apply the pressure here, no? So this blood will push into deep venous system from the superficial vein. Okay. So there are one classification regarding the stocking, British classification. There are multiple classification, but at least you should know the British classification, and on which we have the grades of stocking. Okay. Tell. So one is grade 1 is less than 17 mm, grade 2 is 17 to 24, and third is more than 25. Okay. 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 So if the patient, you can directly apply the grade 3 or you have to do some test. If the patient ABPI, ankle brachial pressure index, is less than 5, you cannot apply grade 3 stocking. Why? It will further aggravate the condition. So before doing the grade 3, before applying the grade 3, you have to revascularize the limb, then you can apply grade 3. For grade 3 I am telling. Okay. So less than 0.5 ABPI you cannot use grade 3. This is question. Okay. Okay. So you have advice for stocking also. Stocking should be a daytime, night time, or 24 hours? 24 hours. Then night time, not daytime. Only daytime. Okay. Only daytime. Okay. If the patient is sleeping in the night. Okay. 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 So you have applied the, you have asked for apply stocking. Any other things you can do? Patient also have complaint of itching. Why itching and pigmentation? Not fat. Hemosiderin deposition. It will cause a discoloration of the skin and itching also. Okay. Okay. Inverted sampan bottle appearance. Okay. Right. Then surgical. So what is the gold standard management for varicose vein? Not flushing, stripping. Which patient allow you flushing and stripping of the vein? Will you allow your great venous vein stripping? Then not sclerotherapy. So endothermal ablation is gold standard treatment for varicose vein. Very famous question. So what is gold standard treatment? Which is gold standard treatment for varicose vein? Endothermal ablation. Okay. So there are two type of thermal ablation, endothermal ablation. One is, and another one is radiofrequency. One is laser, another one is radiofrequency. So which one is costlier? Radiofrequency. Laser is cheaper. Okay. So which patient have less pain? Patient is paying more. So he will bear the pain or he will not tolerate the pain. Okay. If the patient is paying more, so he will not bear the pain. So in radiofrequency there will be less pain. Okay. Okay. So in which case the surgeon will have long learning curve, in laser or radiofrequency? If I am buying the costly car, it is fully automatic. If you buy Maruti 800, you have to learn. Okay. So laser has long learning curve. Radiofrequency ablation, short learning curve. Okay. And remember radiofrequency, F for fixed. Okay. So you fix the parameters. So how much it has to done and everything. Okay. So surgeon in radiofrequency, hands are surgeon free. Okay. So he can do better, better convince the patient. Okay. So hands are free in which? Radiofrequency ablation. This all are MCQ. They will give the question what are the advantage of radiofrequency ablation and disadvantage. Okay. What is disadvantage? If you have the fix, can you change the manipulation? You can do manipulation? No. So you cannot do perforators in, you cannot treat perforator with radiofrequency ablation. Okay. And laser is cheap. Cheap. Okay. Cheap. One more. You have to do this surgery through one anesthesia called tumescent anesthesia. What is tumescent anesthesia? So in tumescent anesthesia there are three components. One is lignocaine, another one is adrenaline, third one is normal saline. Okay. Why tumescent? Okay. So we are doing surgery where important nerves running along with the vein. Okay. I will tell which nerve through which nerve. Okay, I will tell. Okay, so you should avoid the injury of nerve. Okay, so suppose two structure are running, and in between I have given the tumescent anesthesia. So it will increase the space. Okay, so we can avoid the nerve injury. Okay, and further, if suppose we are doing the surgery, inadvertently or accidentally I have perforated this vein. So what will come out? Blood. So it will further compress the venous system. Okay. Okay. So main you have to tell it is prevent the nerve injury. Okay. And also the pain will be also reduced. Okay. Okay. Other type of surgery. You can use sclerotherapy therapy. Okay. It can be ultrasound guided or without ultrasound guided. Okay. So what is the advantage of sclerotherapy over endothermal? No need of tumescent anesthesia in sclerotherapy. Okay. No need of tumescent anesthesia. And how it is made? Through one very famous method. I will tell. Name of the method? Tessari method. Tessari method. So in which we use one sclerogent. What sclerogent? Sodium tetradecyl sulfate. Okay. Okay. And air. So ratio is 4:1. Now you tell which is 4, which is 1. They will ask. Which is cheaper? Sclerogent or air? Air. So air will take 4 part. And 1 part is sclerogent. Okay. Okay. And method name is Tessari method. Okay. Okay. So you have learned sclerotherapy, you have learned endothermal ablation. Okay. There one surgery like stripping of vein and SFJ ligation. Okay. So why it is called flush ligation? They ask. Why it is called flush ligation of SFJ? Why the flush word has been added in this surgery? If we suppose we have the ligated hair, okay, we have ligated this vein here. So this part is remaining, okay, this part is remaining. So it will swelling, there will be swelling na post-op, okay, there will be swelling. So we have to ligate from this part. So that's why it is called flush. Okay. There should be no redundant vein. Okay. So that's why it's called flush ligation. Okay. So we have done the stripping of vein. We can do for great saphenous vein also and short saphenous vein. If we are doing with a great saphenous vein, which nerve can injure? Saphenous nerve. If we are doing for short saphenous vein, then sural nerve. Okay. Remember, this is also MCQ. Great saphenous vein, saphenous, short saphenous vein, sural nerve. Okay. Okay. There are other treatment also, like we can use the glue. Glue also can be used. Okay. Okay. Then mechanochemical ablation, not for you guys. Okay. So you have done the surgery for varicose vein. So what are the complications of surgery? One is nerve injury. They ask most common complication of varicose vein surgery. Wound infection. Ask multiple times. Which is most common infection of varicose vein surgery? Wound infection. Okay, wound infection. Okay. Then patient can have recurrence. Why recurrence? They ask. Why recurrence in varicose vein surgery? Famous question. Because of neovascularization. Okay. And because of if the surgeon has inadequately removed the veins. Okay. He forgot to remove the tributaries of the vein. Okay. At least you should tell neovascularization and the inadequate surgery. Okay. This will lead to the recurrence of the varicose vein. Okay. Tributaries, yes, tributaries. Yes, yes, yes. Okay.